I'm feeling very anxious about postnatal depression. What is it?
Postnatal depression is something which is seen in about 10% of women who deliver children. It is not simply having a low mood, something which anyone would frequently experience at some point in time of their life or the other. In postnatal depression, what you would notice is that the individual is feeling far lower than what they usually would experience, and that mood state tends to last for at least 2 weeks, sometimes even going on for a much longer duration. And at this period in time, you would realize that this person is not being able to enjoy a lot of their regular activities. Sometimes they would also not seem engaged with the newborn child. They would not want to do a lot of the things around the house, their normal regular activities. Their sleep patterns get disturbed. They're not getting enough sleep. They're not eating properly, and these are the constellation of symptoms that you would end up seeing in postnatal depression.
In that case, what is postpartum blues? Is it same as postnatal depression?
Postpartum blues are seen in about 80% women who end up delivering their babies. It is different from depression in the form that postnatal blues tend to remit within about 10 to 14 days, whereas postnatal depression is going to end up continuing beyond the 2-week period and would require immediate attention in that case. Also, the intensity of postpartum blues is far lower than that in case of postnatal depression.
What should be my family's role?
The biggest challenge during this time is going to be the huge change, the huge adjustment that the woman needs to make. And in this period of time, of course, the family, the father play a very big role as well. And the most important thing that they can do for her is going to be giving her a lot of support so that she can do a lot of the things that she was previously doing and which she probably does not have the time to do anymore. And taking on some of those roles and responsibilities is going to be the biggest support that can be given to her.
If I feel I'm depressed, do I need professional help?
Postnatal depression would surely require treatment. Since you are lactating and you would be breastfeeding your child, yes, one would try and avoid medical intervention, but counseling and therapy would play a very big role at this stage, because the attempt would be to ensure that you're being able to take care of your thoughts and your feelings, and you're being able to develop the right kind of coping mechanisms for your own self so that you lead a healthy life with your child.
Since last few weeks, every time I turn on the bed or get out of the car, I feel strong pelvic pain. Is it something to be concerned about?
Swati, the pain that you're experiencing can easily be taken care of if you take care of your postures, how you get in and out of bed, how you stand, how you get out of a chair. All these are going to help you relieve your pain and have a comfortable pregnancy.
Are there any ways to relieve this pain, and will labor and birth increase it?
Swati, there are exercises to relieve your pain. Kegels and pelvic floor exercises help you to build muscles in your pelvis to strengthen them and take care of your pain. Labor and birth will not aggravate your pain.
If you have any questions, please write in the comment below and we'll get the experts to revert back.